Not every man will have to deal with age-related issues like weight gain or hair loss. Whether you have these problems really depends on your health and luck. But one problem just about every man will have to deal with, if he lives long enough, is an enlarged prostate. It's completely natural for the prostate to grow over time, and in most cases, it doesn't cause any serious harm. However, there are several factors that can increase the rate it grows. Some you can't change, but some you can. And knowing the symptoms of an enlarged prostate is crucial in order to take care of your health and prevent any potential complications. So, what are they? Is it just frequent urination, or does it go beyond that? Well, keep watching, because in this video we'll discuss the top 10 symptoms of an enlarged prostate that every man should be aware of for the sake of their health. Remember, these symptoms can also be signs of other health issues, so always consult with your doctor to figure out the underlying cause. With that said, let's speak frankly about the changes your body may experience due to an enlarged prostate. Number 1. Difficulty urinating. When you have urination issues, you might find that you have trouble starting to urinate as well as maintaining the flow. It's one of the signs that men encounter the most frequently. When the prostate gets bigger, it blocks the tube that carries urine from the bladder to your penis. This means that when you feel the urge to pee, you have to force urine to pass through a passage that's more narrow than usual, which takes effort. If left untreated, these symptoms become worse as the prostate continues to grow. So, if you're finding it harder to go, or it takes longer than usual, it may be time to have a checkup with your doctor. Number 2. Urinary frequency and urgency. If you are dealing with frequent, sudden and uncontrollable urges to urinate, then it might be a sign of an enlarged prostate. This symptom can make daily activities, like sitting through a meeting or traveling on long trips, very difficult. Initially, it may be hard to tell that you are going to the toilet more often than usual, but if you find yourself needing to go 8 or more times a day, it's time to talk to your doctor. It can also become so severe that you may not make it to the toilet in time and end up leaking. While occasional bladder fullness is normal, if those sensations become more common or bothersome than usual, it could be a sign of an enlarged prostate. Number 3. Weak stream, dribbling or leakage. A weak stream or dribbling is another common symptom of an enlarged prostate. This occurs because the enlarged prostate forces the bladder to work harder to expel urine, which can weaken its muscles over time. Due to this weak bladder, you may notice that your urine stream is not as strong as it used to be. It can also be difficult to thoroughly empty your bladder, which can cause small amounts of urine to leak out afterward. This leakage may result in spots on your underwear or clothing. If you experience any of these symptoms, it's important to talk to your doctor for a proper diagnosis and treatment. Number 4. Urinating often during the night. While it's normal for men over the age of 50 to wake up once or twice during the night to use the bathroom, frequent nighttime urination could be a sign of an enlarged prostate. If this happens on consecutive nights and without any logical explanation, like consuming alcohol, caffeine, or large amounts of water before bed, it's important to take note. Some medications can also cause increased urination frequency, but if you're not taking any and still experiencing this symptom, it could be due to an enlarged prostate. Number 5. Painful urination. Sometimes men with benign prostatic hyperplasia may experience pain or a burning sensation during urination due to irritation of the bladder or urethra. This irritation can occur because the bladder has difficulty emptying, leading to urine retention and the buildup of bacteria, which can cause inflammation and discomfort. Painful urination can also be a sign of a urinary tract infection, which is more common in men with enlarged prostates. If you are experiencing pain or discomfort while urinating, it's important to visit a doctor to rule out any underlying issues. Number 6. Trouble emptying your bladder. Another sign that could be a red flag for BPH is the inability to empty your bladder completely. This means that even after urination, you may still feel like your bladder is not completely empty. This happens because an enlarged prostate gland can put stress on the urethra, making it harder for urine to flow out of the bladder. As a result, some men with BPH may have difficulty fully emptying their bladders, leading to urinary retention. This can be a source of embarrassment and can also increase the risk of serious complications like urinary tract infections or skin irritation. Number 7. Blood in your urine. Another crucial sign of BPH is the presence of blood in the urine, also known as hematuria. This can happen when the enlarged prostate gland puts pressure on the urethra and causes irritation and inflammation, leading to the presence of blood in the urine. The color of blood in urine can range from light pink to deep red, depending on the severity of the condition. In some cases, the amount of blood may be small and not visibly noticeable, but it can still be detected through a urine test. However, in more severe cases, the blood may be noticeable and accompanied by pain or discomfort during urination. Any presence of blood in the urine should be a cause for concern and warrant a visit to the doctor for proper evaluation and treatment. Number 8. Pain in your lower back and abdomen. In some cases, the pain in the lower back and abdomen can be a symptom of a urinary tract infection, which is caused by bacterial growth in the bladder. A urinary tract infection can also occur alongside an enlarged prostate because of frequent urination and chronic irritation from always feeling like you need to urinate. Because UTIs have similar symptoms to an enlarged prostate, it's important to see a doctor for proper diagnosis and treatment. Ignoring the pain in your lower back and abdomen can lead to serious complications like kidney damage or sepsis. Number 9. Painful ejaculation. Now, this might not be the most common symptom of BPH, but it is worth noting that an enlarged prostate can also cause pain during ejaculation. This can occur due to inflammation and irritation of the prostate gland, which can make ejaculation painful and uncomfortable for men with BPH. It can also lead to a decrease in sexual satisfaction and cause concerns for couples trying to conceive. Painful ejaculation may also be accompanied by other symptoms, like blood in the semen or pain in the pelvic area. If you experience this symptom, don't hesitate to consult a doctor for a proper diagnosis. Number 10. You still need to go. The last common sign of benign prostatic hyperplasia is that even after you've urinated, you still feel like you need to go. This can be frustrating and disruptive, especially in situations where bathroom access is limited. The reason behind this symptom is similar to the difficulty emptying your bladder. An enlarged prostate puts pressure on the urethra, making it harder for urine to flow out smoothly. As a result, some men with BPH may feel like they need to go back to the bathroom soon after they just urinated. If this happens frequently, it's important to see a doctor for proper evaluation and treatment. So, these are the 10 common signs of benign prostatic hyperplasia that every man should be aware of in order to take care of their prostate health. If you are experiencing any of these symptoms, don't ignore them and take action by consulting a doctor. BPH is a treatable condition, and early detection can lead to better outcomes and an improved quality of life. Remember, while these symptoms may be caused by BPH, they can also be indicators of other, more serious conditions, so it's best to get a proper diagnosis from a healthcare professional. Taking care of your overall health through a balanced diet, regular exercise, and avoiding certain risk factors like smoking and excessive alcohol consumption can also help prevent or delay the onset of BPH. With proper care and management, you can maintain a healthy prostate and continue living your life to the fullest. We hope this video has given you valuable information and insights about enlarged prostate and its symptoms. If you found this video helpful, please don't forget to like and subscribe to our channel for more health-related content.